nominated the Community Health Endowment in Lincoln. What I know about the organization is that they were created in 1998, really from proceeds of the sale of then Lincoln General Hospital from the city of Lincoln to Bryan Hospital, and the community really wanted to figure out how to best use those proceeds to support health-related issues in Lincoln. I think the Community Health Endowment in Lincoln is worthy of this award because, frankly, in my mind, they're really mission in action. But from a health standpoint, the Health Endowment is really the foundation that leads us as a community. They manage those very precious resources to give value to our efforts to try to find solutions. And I think they really bring the community together to challenge us to collaborate and to think together in ways that none of us would probably do by ourselves. I think they're a champion for philanthropy because they really use those limited resources that are so precious for all of us to really champion health issues in the community. For example, they recently completed a project called Place Matters. And their goal was to look at issues in our community from a perspective of where we work and where we live and where we play and how they affect our health. And so they mapped out things like obesity and poverty and access to health care and immunizations and those issues by maps in Lincoln. Now that's great information for us to look at and to be amazed about. But through that project, they also create this then box of data, this book of data that all of us can use to more objectively talk about the issues at hand. That's a project that none of us could do by ourselves, and yet we're enriched as a community to have access to that data moving forward. I nominated the Community Health Endowment because I've seen firsthand the value that their participation in addressing those health-related issues in our community can have on the community. And frankly, I was hoping by that nomination that others could see that value as well. The Community Health Endowment's been a big supporter of our efforts at the Bridge. We really address complex issues on the part of the clients that we see, and the Community Health Endowment has really supported those efforts. For example, they helped us several years ago look at substance use trends in our community, both alcohol and drug, and it helped us really analyze the use of those substances in ways that we couldn't do by ourselves. More recently, they've helped us acquire the services in collaboration with People's Health Center to bring a doctor into our facility for a couple of hours a day to work with our withdrawal clients to help them access health care that they wouldn't be able to access any other way, and to help cut down on that recidivism that we see in that population as we serve those clients. The Bridge Behavioral Health is an amazing, dynamic, 33-year young nonprofit in Lincoln. We are a 68-bed substance use treatment center that addresses a whole range of substance use and behavioral health issues. Most of the services that we provide, we're the only provider in our community, the only provider in the region in which we serve. We're blessed by having a staff of some 50 employees and a board of directors of some 15 members that really help us stay on focus. We're open 24 hours a day, 7 days a week. We serve clients really in mission of helping men and women with limited financial resources heal the wounds of substance use and return to the community as productive citizens. That's what we're about. That's what our services are geared toward. And we're just blessed beyond blessing to be able to have the resources to be able to come to work and try to do that every day.